Saranne Rothberg, CEO and founder of Comedy Cures Foundation. Please welcome them to the stage.
So just to give you a little background, I'm a stage 4 cancer survivor with no visible disease. And I started Comedy Cures from my chemo chair, April 30th, 1999, to bring joy, laughter, and humor to my fellow patients and their caregivers. And at this point, we've helped over 1 million people worldwide find their funny bone and laugh. And at about 4 o'clock, after we've been sitting here all day, you're all in a food coma and you've heard so much. So I'm going to give you a little exercise, which is very fitting for this panel, which is putting kids first. And we all have a child in us. So I want to do one laugh for you. I want you to stand up. Put your arms in the air. Wave them like you just don't care. Okay? Good. Now we're getting all that circulation going. This is a conference about health and wellness. If you're feeling a little dizzy, you can either sit down or put your hand on the chair in front of you. Do not hit your head. We're going to do one of my favorite laughs. It's called a roller coaster laugh. We're going to do it 2 times. If your own laugh takes over, let's go with it. Ready? Ha 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 ha. One more. Ha 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 ha. Give yourselves a round of applause. You can sit down. If you like comedy, you can call my laugh line. It's 1-888 ha 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 ha. We're gonna say that. Ready? 1-888 ha 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 ha. Now we're gonna laugh it. 1-888 ha 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 ha. Very good. If you press 1, there's a professional comedian. If you press 2, it's an amateur, any one of us. And if you press 3, you can tell me a joke 24 hours a day. So I expect everyone here to tell me a joke. Now to our panel. You guys, I have a personal connection to each and every one of you and what you're trying to do in healthcare. And so I applaud you as a consumer of what you're doing. So let's start with Yishai. Help around. Why? How?
So I'll start with a quick story about myself. I was fortunate to grow up healthy and without any serious disease in my family. But I did have one burden. Is there anyone here who sometimes loses their stuff? Okay. I was a mess. I think I should have been put up for adoption by my parents because I just couldn't get a hold of my things. What do I do? When do I do? So when this thing came out, some people started sending photos of their cats. For me, this was a lifesaver. I have tiles connected everywhere. I have ringers. I ask Alexa, where are my keys? Live example. Live example. My mom should be watching this. So then when I came into the world of healthcare, which was 10 years ago in type 1 diabetes company, we invented the first connected glucose monitor. And I was acquainted to the burden, the logistical burden that families with a difficult, life-changing disease need to deal with. And I realized that what we have to manage, they have to manage 10x of that. So someone with type 1 diabetes, they have sensors, they need to inject insulin, they have to monitor when they travel, the blood sugar go crazy, when they don't sleep at night, it goes crazy, when they eat something, and you know what's that constant sense? Failure. You fail, and you fail, and you fail, and you fail. So as time went by, so this is why we started Help Around. We started Help Around because we wanted to find help around each one of us. Using technology, using the phone, we will find help wherever you are, and today we help connect that to what's called the patient journey. Patient journey is what drug manufacturers call the maze that a patient has to go through when to get on the drug that they need. So getting on therapy, getting on a drug, after you got a prescription, in this world, which is called specialty, rare disease and orphan drugs are a big part of it, is a maze. There are between 20, 30, 50% of patients who never get the drug they need, even though they have their prescription. So for us, our mission is to get patients to the therapy that they were prescribed and make life easier on the way so they don't have to just bury in faxes and letters and phone calls, which is the current status quo in the American healthcare
So
system.
this is a godsend for parents of children with rare disease, because you're juggling family, you're juggling the children, you're juggling all the medical care, and you guys short circuit all of that and help the families get the children to the right disease, to the right
The right drug, the right
drugs.
therapy. So they typically, actually, so there's the specialty world where getting to get the drug is a huge achievement. In the world of rare diseases, getting to the right doctor that has ever seen this kind of these kind of symptoms and can connect the dots is a huge achievement in and of its own. So I think we have an even more complicated situation here when getting to the diagnosis is a huge undertaking, and after that, getting on the therapy and actually staying on it and seeing whether it actually works for you. And one more comment. I think today, with precision medicine, in the future, all diseases will be rare diseases. And the reason is that today there's no one breast cancer. There are 20, 30, 40 mutations of breast cancer. Each one of them is a patient pool that is tiny. So the industry and the drug industry, the healthcare industry needs to prepare for a day where every disease is rare disease.
It's interesting because I did 7 different chemo drugs, and I was completely chemo resistant. And when I was diagnosed, my particular cancer wasn't even named. It was just that terrible cancer that young women get. So I would have been a candidate for exactly what you're offering. Hi, Linda.
Hi, how are
Hi.
you?
You're already rocking and rolling. You're in 85 countries.
Yeah,
That's amazing. In 4 languages.
5.
5 languages now. So tell us about Curatio.
Sure. Curatio is what we call a social health prescription, and what that means is we match patients to other patients and families to other families that are going through the same thing. The easiest way to think of it is a completely private and secure social network like Facebook, with a little bit of matchmaking and Tinder thrown in, and a whole suite of daily disease management tools that just make living with a rare, chronic, or any health condition a bit easier.
And again, this all relates so personally. My daughter was born with her organs reversed. And it was very isolating, and there was no one to talk to us about it. And the only information was at a medical library uptown in New York City. And there were so few people even documented in medical journals. And this would have provided for our family a way to connect with other people, healthcare professionals, and to find out that we weren't the only family living with reversal of organs.
Exactly. And our mission statement is no patient alone, because that's exactly what we want to do, is connect people. In one of our very early deployments, it was a small group, young adult survivors of cancer. There were about 300 people in that group. And we had one young fellow in Vancouver who had a rare type of cancer, had never met anyone else. He was about 17. And lo and behold, even in a small group of 300, we found another match for him, another young fellow. He's about 20 in the Midwest, had the same form of cancer. And they eventually got together that summer and learned a lot from each other. So there's the connection piece in addressing some of the stigma, the isolation, the unknown. But on the flip side, there's the wisdom of the crowd. And even though these are small crowds when we're talking about rare diseases, the wisdom of that small crowd is immense in terms of not only treatment protocol, but R&D.
You just think about the loneliness and the struggle. And now with your app, families have resources at their fingertips around the clock.
Yeah.
And the amount of time that families spent before your app just trying to navigate the very basics of any illness.
Yeah, exactly.
Thank you. And lastly, but not least, we have Jason. And you're near and dear to my heart because I was a special ed teacher
Yes.
decades ago. And I know firsthand the struggles of what it takes for families to navigate with disabilities. And here you come along with Special X, which is a working title.
Yes.
I was going to buy him the website because I went to look him up online and it said it was for sale. And I thought, what a nice moderator gift if on stage I give him the website, specialx.com. But we know it's a working title.
That's right.
Tell us where you are in this
Yeah,
process.
we're just at the beginning, but our mission, inspired by my own journey and my son's journey, Noah, is to help every family raising a child with disabilities get the best care possible so their child can live their best life. And, my son, I have 3 boys. My oldest son, Noah, who's almost 12 years old, was born with, at the time, what was called cerebral palsy. We went on a 4-year diagnostic journey and got a diagnosis with a rare genetic condition called FOXG1. And then the journey kept going through this maze that was described earlier. And my wife would like everybody to know she has the PhD. I only have a BS in engineering. But for 2 college-educated parents going through this maze and struggling with the grief of a child that's not what you expected, beautiful boy, amazing spirit, but different, then you turn around and you deal with, that's a cycle of grief, and I describe what we're dealing with for our families, the cycle of WTF. Like, how do I deal with insurance? What is this school process that's just totally different and nobody knows about it? You've got to talk to people in the waiting room to learn about it. How to deal with finding therapies, and that struggle that we had in trying to help Noah live his best life was isolating, and then you realized as we started talking to other families that everybody was dealing with this same cycle of WTF and grief. And so we set out to build a platform that combines technology with the power of people. We bring in expert guides. So 40% of families who have a child with disabilities has a parent leave the workforce. Those parents go out and build up these set of skills that they can navigate this world. So we're hiring the best and brightest from that group of parents to serve our customers.
You call them care navigators, right?
Navigators, right.
Amazing.
And then as they serve those families, we build up this shared knowledge. And the ultimate goal is there are 100 million families in the world raising kids with disabilities. Why aren't we all working together collectively to get the best care possible for every child?
So just the financial burden of
Right.
a family living with a family member or child with illness, particularly rare disease, and the insurance, the amount of energy that you need to put just towards getting insurance qualifications and reimbursements. How are your different platforms helping with the financial aspect of rare disease or disability?
We have on our team, we have insurance advocates who know how to work the systems, whatever the care plan is, to make sure parents understand how to maximize their benefits, how to find therapists that are within coverage, or if it's out of coverage, how to get out of network reimbursement. And it's a maze in and of itself. And ultimately, if you're dealing with trying to help your child, you don't want to get lost in that maze of becoming an insurance expert. You want to give them the best that you can, and so that's how we're supporting.
Well, it's a time thing. I mean, just having a child whose organs are reversed, you have to work.
Right.
And you have a whole full-time job at navigating the healthcare system.
Yep.
So everything that you're doing is so powerful in transforming, particularly the parent experience. So many families with children in particular living with a disability or a disease, the family ends in divorce. There is a divorce. I'm one of the casualties. So it's really incredible how you're supporting the family unit Can you talk about some of that?
Yeah, it's a really interesting point because we started out looking at patient-to-patient support, and then we quickly realized that caregivers, families, spouses, parents needed their own pathway as well. So now we match on multiple roles, so we can match patient-to-patient, caregiver, parent-to-parent. Because the health and well-being of that caregiver or parent is equally important. And lots of research around, the overall health of the family and the outcomes related to the child or the person.
Yeah, there's a statistic and some deep research around this. A parent with a child with autism, a mother in particular, when they do the analysis of cortisol levels, they have similar levels to a soldier coming back from war.
Which
PTSD.
they say it can be a predictor of cancer.
Really?
That high cortisol levels can be something to really look at and signal that you're on a watch for cancer.
And back to your point about,
Yeah.
about financial options, I think when we looked at the ecosystem, designed to support that the patient's family, this is a for-profit environment. So when you look at who's aligned, you realize something really interesting. There is a very big force whose interest is for you or for the family to get on that therapy and succeed, and that's a drug manufacturer. So when you think about affordability, financial options, actually there's someone out there that has the same interest as a patient. And you know something, what we discovered? We discovered that drug manufacturers actually put out there an entire ecosystem of vendors, including copay providers and hub services and reimbursement consultants and patient assistant programs, except they do it in a way that is not very user-friendly. But it's there.
It's a communication issue.
It's a
for sure.
communication, and we are now at the point where, while we talked, probably 5 people in the audience ordered something on Amazon, on mobile. But this ecosystem, healthcare and drug manufacturers are not Amazon, and they don't think they're Amazon. So they haven't found a way to make it so accessible and so easy to use, but now they start to come to us and understand and ask for help. And it's happening. It's working. We are seeing a lot of success with 27% longer time on therapy. Patients stay on the therapy that we're prescribed, and a lot of that is through affordability. So I think that's a huge piece, and you got to understand who your ally here is. And the patient's ally, maybe surprisingly, is a drug company.
You bring up a good point, and that's I've seen from helping so many families through Comedy Cures. You could have a CEO, you could have a diplomat, highly educated people, and when it comes to their own children and their health care, it's as if all the degrees and the logic and strategy goes out the window because you're operating from panic and emotion and fear. So it takes a while for that, killer instinct. I'm not going to stop at, anything, because you're just going through all the 5 stages, denial, depression, everything that you're going through, anger. And so to have resources that can hold hands, and I get calls all the time for people asking, are there any drugs? Can you get me to pharma companies? Do you know how I could possibly get that drug? Or it's too expensive. We can't afford that drug.
Yeah, I think it's interesting. As a parent myself, I think about that emotion, going through this cycle of grief and trying to be, the best caregiver I can for my son Noah, and it gets cloudy fast because of that emotion. And we have navigators who have their own kids with disabilities, and we have these staff meetings where they'll talk about this exact point. Like, they can help somebody else. They can help them be that killer for their child, but then when they're talking about their own, all the confidence goes away, and they're dealing with those challenges of, how do I do this for my own child?
So let's take it one step, right? Educated, degrees, intelligence. I sit there and I say, what happens when English is your second language? Now, you've addressed some of that by having your platform in 5 different languages. But now you're trying to do everything under all that stress with the time limitations, and you're lower socioeconomic, you're working 2 jobs, and English is your second language. How are we using technology to help those families with rare disease or
So I think
disabilities?
so first of all, I think the availability of, remote translation services is really critical, but I want to go back to the shopping, extreme shopping Amazon example, because it's the most familiar, and it's also where most of the technology has gone there to get you to buy something. There's good news. That technology is now being funneled or channeled towards healthcare. Where in the past you would want to buy something from the US or from China or from wherever, and you just wanted to get there, people had interest to get you that service in the language that you need. And you don't need to be, you don't have to have high literacy for that. So when we are managing, when the family is managing that situation, we should all assume that we're dropping off 50 points of IQ because we're terrified, fight or flight, freeze. We can't function at a high cognitive level. So for us, the task on us is to take that technology that until now has only been in retail and shopping and ads, et cetera, and bring it to patients who really need it at that moment. And selfishly do a sneak peek of something we're announcing tomorrow, which is we actually partnered with 2 great companies, Braze and Neura, to basically figure out when is the best time to engage a patient without them telling us anything. So when I wake up in the morning, I get the message. When I woke up in the morning, that's when I want to get it. Or don't give it to me while I'm driving, because that drives me nuts. And we were able to show 60% increase in people actually responding to these messages. So I think it's a good time to be in technology and bringing technologies from other fields to healthcare and do good in addition to doing well, which is also important.
Linda, how are you reaching people? You're already in 85 countries. What are you doing to reach all socioeconomic groups?
One of the things that just gives me goosebumps is when I see people reaching across, countries and continents and sharing information about what the protocol might be there and what it is in their country, and so much learning that's happening there. So, we're also narrowing that knowledge and economic divide in many ways because we're getting knowledge and information into the hands of everyone. So that's been really powerful to see. It's a very grassroots kind of approach, and certainly we have the checks in place to make sure there's not erroneous information or information that would be harmful, and we're not a medical, advice platform. So we put all those checks and balances in place, but nonetheless, to see someone and a family that's struggling with thalassemia in India and to find out what best practice care is in Greece is quite phenomenal.
I would love to do a television show where I unite your families. It would be so awesome.
Yeah, that would be
We should
great.
talk about that.
That would be so great.
No, really, let's bring them together.
yeah.
But do it for the first time on video.
Yeah, I'd love that.
We're making deals here. And how are you?
Yeah, I would just add that I think one thing when you think about rare diseases that they typically mean multiple specialists, and in the case of kids, they also mean not just healthcare maze, but education maze. So the complexity of that, then you add in language, socioeconomics, and it's a really difficult problem to solve with only technology. And the community, and in our case, we're hiring navigators from the community who understand the particular challenges that community faces in navigating systems that they're not used to working for them, or even have understandable concerns and fears about those systems and what they might do with their information. And so that's a critical piece of the puzzle, is that human element to really meet the families where they're at and really support them in the way that is most appropriate to them.
but just using your care navigators to keep the child on track educationally, because they're missing so much school because of appointments or pain or treatments, and to have you guys to help navigate the school system so that child doesn't fall further behind.
Yeah,
It's
that's
really
big.
powerful. So we are completely out of time. You guys are just delightful. I applaud each and every one of you. Can I get a round of applause?